Hey, good morning, Facebook world. It's Wednesday morning. I'm actually just leaving a networking group right now that I'm involved with every week, and the networking group that I'm with is actually a group of people. It's a BNI. If you've ever heard of BNI, Business Networkers International, and I was actually asked because most of the networking people there are business owners, and business owners today, one of the biggest costs of healthcare or one of the biggest costs they have is healthcare for their employees. And so I actually told a story this morning about a patient that I had probably about a month or so ago that was having some abdominal problems, pain over the weekend, and she was pretty scared. And so she went into the urgent care, and they ran a battery of tests. And they basically came to her and said, we're not really sure what it is. It could be appendicitis, but our tests don't show anything, so we're going to send you to the ER. So this girl works with a corporation. She goes to the ER that weekend, and they run a ton of tests, and they come back and say, we don't have any answer for you. So they literally send her home with zero answers, and her bill, she spent over $50,000 in medical diagnostic tests to where they gave her zero answers. And she actually came in and saw me the following Monday or Tuesday, I believe it was. And she told me the story. And they said they didn't know what it was. And the amazing part in our world is I do both chiropractic and nutrition response testing. And this girl who had appendicitis type symptoms, major abdominal pain, and they didn't know what it was, they ran $50,000 plus worth of diagnostic medical tests that showed nothing and came back with no answers. And I literally did a couple tests in less than 5 minutes. No blood work needed, no nothing, and actually found out the answer to her problem, which was actually some dairy sensitivities giving her abdominal issues over the weekend. And honestly, it cost us about $50. She spent $50 in our office compared to $50,000 plus in a couple days over a weekend to get a bunch of tests that told her nothing. And this is why I bring up the whole healthcare cost. People are spending hundreds of thousands of dollars on medical costs every day, going bankrupt. Bankruptcy, so healthcare costs are number one cause of bankruptcy in families today in America. And we're spending all this money for literally, very, very few answers, if any. And so I put this challenge out to you. I want to talk to people. I want to get in front of organizations, groups, businesses, etc., because healthcare is the number one expense. That's what people are going broke over. Imagine, being a 20 or 30-year-old like this girl was, and she now has $50,000 plus worth of healthcare costs on her hands from tests that gave her zero answers. And now she has a debt. She has a debt that gave her nothing, and we actually fixed it for about $50. So I want to get in front of some people. If you have people in this area, Orlando area, or if you are in a different part of the world and you need help, let me know. We know people in the country who can help you with this stuff, and we're gonna fix this girl, help this girl get back to where she's supposed to be for a fraction. Literally, if you want to do the actual numbers, for less than 1% of what she spent already in medical costs to get her healthy again, just by helping her with her lifestyle, getting her on some things that will actually take care of her body, changing some things up, bringing some stress down in her life. But literally, this girl spent over $50,000 in a matter of a couple days or a weekend to get no answers and medications thrown at her, when the solution was very simple. Actually came down to lifestyle, handling a few things in the diet. Let's get some adjustments going, make sure that spine is taken care of, because if you have obstruction or if you have any bone out of alignment, pushing on any nerves that are controlling those organs, you're going to have formations in your body. You're going to have disease processes potentially, and get those handled, because the cost of that, number one reason people don't take on healthcare costs is because they're worried about the expense of it. Yet when they don't take care of it, they end up building up huge bills because they didn't take care of it in the first place. So people end up spending $50, $100, $500,000 because they were afraid to spend money up front to be proactive, and now they're being reactive. And that's what the sick care system is. I never call it a healthcare system. It's called a sick care system. It's disease management. It's not healthcare. Healthcare is proactive. Healthcare is making sure you're eating properly, making sure you're getting adjusted, making sure if you need supplementation, you take that. Sick care is when you're managing a bunch of diseases that they put a name on. You're going in to get the next medication, but then next thing you know, you have 3, 4, or 5 medications, and now you're getting side effects from those medications you never even had in the first place, and now you're spending hundreds of thousands of dollars. And you may say insurance is going to cover it. You know, prescription medications on my insurance. You always pay for it in the end. It's always going to come out of you, because the insurance company will drop you at some point. Your deductible will go higher. The money is coming out of you at some point. And that's why people are actually going bankrupt today. So I want to save you money and get you proactive about your health care and to get out of the sick care paradigm. So just tracing back, again, had a girl come in a couple months ago. She spent over $50,000 in less than 2 days for no answers from the medical system. And we helped her in our office in less than 5 minutes for less than 1% of the cost that she spent in medical tests that gave her no answers. So think about your health, think about where it's coming from, think about how you can change that, get us in touch with some people that we can actually help, get that message spread. Off to the office today to help a lot of people with chiropractic, nutrition response tests that get them taken care of. I love what I do. I don't have a job. I get to help people every single day and change the actual world. So take care of yourself. Stay tuned for more of these really cool Facebook Live things. You're going to do some Periscope, some social media, getting the message out there. We'll talk to you soon. Have a great day, and please stay healthy, stay proactive about your health. Take care.